Lynn, you're muted.
Thank you, Amy, for noticing that. I was saying good morning, everybody. It's just a couple of minutes before 10, so we'll give folks a few more minutes to join. And if you could please mute your microphones, but turn your cameras on if you're able to, because our presenter for the day likes to see people who she's talking to. So we'll give it just one more minute here as folks are steadily joining up, and then we'll get started.
And Amy or Lynn, if you check the chat box as we go along to let me know if anything's entered in there, I'd really appreciate that.
Thanks for that reminder, Sandy. I'll try to keep an eye on that for us. Well, I've got 10 o'clock, so let's just go ahead and get started. We have with us today Sandy Rees from the IPS Employment Center.
This is Lynn again. I was just looking at this credit. He's pretty far behind. He's not going to be done.
There we go.
Yeah. If participants could make sure that you're muted, that would help us. And cameras on, if you're comfortable doing that, that'd be helpful as well. Also, in the chat box is the link to today's PowerPoint. So you can download that for your own computer if you wish. And Sandy from the IPS Employment Center, take it away. Thank you.
Thanks, Lynn. Good morning, everybody. And for those of you that joined us last week, welcome back. And as Lynn mentioned, if you can turn on your camera, that'd be great, because I feel like it's easier. I'm a presenter that likes for people to be involved in presentations and not just to be talking at people. So there are moments where I'm going to say, let's unmute your mics, because I'm going to ask a question, and I would really appreciate if people would engage in a conversation. This is all about sharing information. I think we learn from each other. I don't consider myself to be the expert on everything. I say I'm always working on it. I continue to try to work towards that, but I'm not. So I really like to hear from other people. I was wondering, and this could be a show of hands or, however you're most comfortable, but how many people that are on this webinar are MCOs or work for MCOs, managed care entities or managed care companies? Okay, I can see D is. Thank you, D. Anyone else? Okay. Okay, Dee, I might be counting on you some with this, because, I know with managed care entities that you really kind of follow.
Oh, Bobby O'Donnell, I haven't seen her in a long time.
Folks, can you make sure your mics are muted at this point? Thank you.
You follow the values of social determinants of health. And so this is really what this presentation is all about, is how does evidence-based practices and providing evidence-based practices impact on the social determinants of health. And I'm wondering, before we get started on that, whether those of you that were on the webinar last Friday have any questions that were left over from that webinar. We talked a lot about evidence-based practices and what those are, and IPS, which is individual placement and support. We talked about the research behind it, the practice principles involved with IPS. So I didn't know if anybody had any lingering questions. Okay, well, if not, we'll get started. And I am going to get this PowerPoint up there, I think. Share screen. Okay, so hopefully
Yep,
Yeah.
you're good.
Okay, thank you, Lynn. I was going to say, give me a nod of the head that you can see what the PowerPoint. Okay, so what is the connection between employment and health? And what we believe is employment is critical for a mental health intervention. And we know this through all kinds of, people that have actually told us this. So this is working individuals, working people that have behavioral health conditions that tell us that working has been as important as anything else as far as their recovery and being able to move on with their lives. So you can give people medication, but it doesn't necessarily result in the person's recovery. I mean, it does, but it doesn't. You need both of them going together. So medication along with providing employment services or educational services or housing services, all those things need to go hand in hand in order to help the person move on. So it's a critical intervention. So the social determinants of health, and I picked 5 of them, and Dee might be able to tell us, I'm sure there's more, but these are 5 that were listed under CDC, so the disease control and prevention. And so one of them is access to quality healthcare, which I'm sure you can all imagine how important that is. And in our lives, most of us have those benefits, and you just know you cling to them. You know how important they are. They can be very expensive, but having access to good health care is really important. Access to quality education, social and community context, neighborhood and built environment. And so I don't know if anybody has any other information under these 4 bullets, what exactly these are, or what you think about them. And Dee, I don't know if you can add to it, but these are all indicators of things that people have in their lives that help them to be healthier. And the last one I have on here is economic stability, which is the one employment will fit under. And so the connection between financial resources that people have, income, the cost of living, socioeconomic status, their health, these areas include key issues such as poverty, employment, food security, and housing stability. Go ahead. Did somebody have a question? Okay, so all of these fit under economic stability, right? You're much more likely to have stable housing if you have an income. So what we know is, according to the World Health Organization, people that have serious mental health disorders die 10 to 25 years earlier than the general population. So that's a lot. I mean, if you think of 25 years, that's a lot of time. People die at a much younger age than the average population. And that the vast majority of deaths for people with serious mental illnesses are preventable. Or we could call it modifiable. So you can modify what's going on in people's lives in order to help them live longer. So people with mental illnesses have increased risks of heart disease and other preventable conditions due to poverty, social isolation and trauma, lack of access to quality health care, psychopharmaceutical effects, substance use, increased tobacco use, and obesity. So these are all factors that lead to earlier deaths. And you'll find them at higher rates for people that have a mental health condition. So how might employment reduce the risk factors of preventable illnesses? So if somebody's working. So if we think about, the idea of reduced poverty, socialization, and trauma, earned income gives people a sense of contributing and belonging to the community. And again, we talked about this last week, but if you think about the general population of people when the pandemic came along, it just impacted people in this area as far as people losing their jobs, being socially isolated. So I think it kind of brought home, this is how a lot of people with mental illness live their lives. And I think for us, it kind of sent a message or a sense of like, it doesn't feel good. Sometimes we distance ourselves from this, but it doesn't feel good to be in that way. So, our jobs really help us to belong to a community. Improved access to quality health care. So we have employer paid benefits. That's sometimes hard to get, but a lot of states do have affordable health care. But employers, I was kind of surprised when my son went to work for Kroger. And I don't know if you have Kroger in Iowa, but it's a huge grocery store chain. And he went there and he was started out at 20 hours a week, and he was provided, it's union, and he was provided benefits, and they're really good benefits. They're better than I have. It's very affordable, and it's dental and healthcare, and it's like that's worth so much. And so, helping people to think about the benefits they can get, mental health, medical benefits, by working is something we want to talk to people about, as opposed to let's help you get on Social Security benefits. The psychopharmaceutical effects, the IPS team, and we talked about this last week. And so those of you that weren't on the call, IPS teams are integrated. And so employment is integrated in with a clinical treatment team. And so like my team that I supervised, we had case managers that would help out with housing and food assistance. We had therapists. That work with co-occurring disorders. That's substance use and mental health. We had a psychiatrist, and we had a psychiatric nurse practitioner. And so we've worked very closely with them. And when people were on medication, often the treatment team were the people that noticed that there was something going on. And a lot of times people are on lots of medication. They're prescribed multiple types of antipsychotic medication. So they're prescribed a lot of different medications. And the team would be the ones noticing maybe this person's suffering some side effects. They seem to be over-medicated. And they've talked to the psychiatrist. We talked to the psychiatrist and the nurse during our treatment team meetings to let them know what we saw. And they really appreciate it. They'd be there at the team meetings and reviewing everybody they'd be seeing for the day and providing feedback. Substance use. Employment gives people a sense of purpose and a reason to get up in the morning, and reduces substance use. And we've seen that through our research trials. People using substances, if they're provided with employment at the same time they're receiving treatment, they're more likely to reduce their use if they're helped to look for a job, because it provides them with a sense of hopefulness. The team is giving them a message that we believe they're capable of doing this. And so at the same time they're receiving treatment, they're also involved in looking for employment. And therefore, people, if they get a job that they really want to go to, and I can tell you about one man. I talked about somebody last week, but there was another person. There's so many of them, and he was somebody that was enrolled when we did a study. This was a Social Security study years ago, and he was enrolled. He had worked in, I think it was 7 years, and when he got enrolled into the study, he was drinking, I call it a short case, 12 beers every night. And he'd been doing that for years and years, every night. That's a lot of alcohol to drink. And he started working with our team, and he was getting treatment from the team, and he was enrolled in employment, and the employment specialist helped him to find a job that he wanted. And so this job, he'd gone to it, he had seen what it looked like. He applied and got the job, and he was so excited about it. His first time working in like 6 years, a job he really wanted. And he said, and the job was Monday through Thursday. And so he said, I will stop drinking on Sunday night and I'll start drinking on Thursday night, but I won't drink the nights that I work. So, I mean, that's not like saying I'm going to be abstinent and I'm not going to ever drink again, but that means that was 4 nights times 12. I mean, think about the reduction in alcohol that was for him. And he did. And he even came up with the strategy of saying, I'm going to give my mother my debit card. That way I won't have easy access to cash during the week. And then I probably shouldn't say this with Vienna on the call, but the VR counselor, he said, we asked him, he said, what is it about drinking beer? I mean, what is it that you really like? I think that's an important question to ask people with substance use. It's not like just like, don't do it, it's bad. It's like, what is it that you like about it? And he said, I just love sitting and watching sports with a cold one in my hand. And so the VR counselor bought him like a case of Coke because he's like Coca-Cola. And so she said, well, it's a barrier. So she ordered him like pop so he could sit there. Not that that was super healthy. I mean, we can get to other ways that that's not healthy. But anyway, he could sit there with a cold can in his hand and watch sports. And it just seemed to kind of help him during the week. But we got these other issues. So drinking a lot of soda pop, like I said, isn't a good thing either. Anyway, he was successful. It was an amazing story, I'm telling you, because that man came back and showed us his calendar. And he said, look at my calendar before I started working. And it was blank pages. And he said, look at it now. And he had picked up a guitar again, which he loved to play his guitar. And he was helping at the local recreation center. He was tutoring kids, teaching them how to play guitar. And he started going back to church again. And so his calendar was filling in. I mean, once he started working, he said, I'm busy. So, I mean, it was just amazing to listen to. So tobacco, we know that that's can impact people's health. And most employers that I know of now, I don't know how it is in Iowa, but it's certainly restricted in most places where you can't smoke at your business inside. So it's really kind of reduced the amount of smoking people do. I mean, there was a point where everybody could sit at their desk and smoke at any time during the day. So that's been greatly reduced. And obesity, with employment, it fills in for boredom, being sedentary. So, when you're home all day long and you're not working and you're watching TV, it can be boring. I mean, you're going to eat more and snack more. So we were going to do a breakout room, but what I'd rather do right now is have a discussion. And so what I want to do is have people unmute their mics, if you will. And my question to you is, in your life, when you think about your life, what has employment done for you? What purpose has employment served for you? Why do you get up in the morning and go to work? And we can think about that in terms of how that benefits your overall health. So does anybody want to tell me why they get up and go to work in the morning?
Things to do, things to get done. Like
Okay.
you set goals. And I think about often times in my life when I have been unemployed, and it's a rapid path to depression.
Yeah, thanks, Lynn. Yeah, I'll ask you. Go ahead.
I think purpose. I think it just gives people, I mean, kind of like Lynn said, like you set a goal and it gives a purpose to, and motivation. Like, I think it makes you motivated overall to get other areas like I'm getting up, there's a purpose to do stuff, to have finances, to fulfill other areas as well. Friendship, like your coworkers, it gives you a sense of purpose to get to see your coworkers, fulfill like that need, and those relationships.
That's so true. And I just think we take that for granted. I mean, I really think that I've talked to people that don't stop to think about how important work is. They just do it. They're going through the motion of working. They've always worked. It's never been an issue for them. So they just don't think about that. And they take for granted things like coworkers. And I worked with this woman. Her name was also Sandy. And she worked at Costco. She was a demonstrator, food demo person at Costco. And she hadn't worked in quite a while. And she was like very depressed and very withdrawn. And we had to work a lot with her on smiling because she would never smile. And you need to do that when you're a demo person, when customers come up. But anyway, she worked there for quite a few years. But during the holidays, one of her coworkers gave her a card that said, "We'll be friends forever." And she brought it in and she said, "Nobody has ever said this to me in my life. I've never had anybody acknowledge me in this way." And I mean, to me, it's kind of like, wow. I mean, yes, I mean, coworkers are some of our biggest supports. So
I love to golf, and most of my golfing buddies are all people I met through work, so you do think about, even when you're doing things during your off time, a lot of it is from associations you've made through work. So
thanks, Ken. Yeah, I agree. It's like my work buddies. I mean, I left this job where I worked as an IPS supervisor 11 years ago, and I love seeing them. We get together and we have a real bond. So if you're without that, how do you think that impacts your health? Not to have that in your life. It's socially isolating. Anybody else? A benefit of working? I can wait. I'm really good at waiting because I know you're all thinking about it. So I'm okay with waiting a few seconds if people want to think about other benefits to working.
Some people's jobs give them opportunities that they wouldn't have, without having that job. Like thinking about people that travel for their work, or like truck drivers that get to see different parts of the country and things like that.
Yeah, I love that one, Lynn. I get to travel for work all the time, and I absolutely love it. I love getting to go. Plus, I don't know if people know this if they weren't on last week, but I live in Portland, Oregon, which actually has gotten really warm recently. But, typically during the year, it is super gray and rainy and overcast. And so it gives me a chance to get out of here because it's really depressing during the winter. But yeah, it gives you opportunities for different things in your life that you may not have a chance to do.
So one of the things that I've worked with people for many years in work, and whenever we've asked them this questionnaire, and I agree for myself, this is also the case, work is normal. So,
Yeah.
What's the first thing that someone asks you when you go to, a class reunion, or you haven't seen a friend in a while and you run into them in the grocery store? The first thing they ask you is, what do you do? And so for people who aren't working, that's a very difficult question to answer. And so when they work, they feel like they're normal,
Yeah.
So it's a very normal thing to do. So.
Right. It's a typical adult role that people have. And it's isn't exactly what you're saying. It's a part of our identity. It's a part of who we are, right? It doesn't take long before people say what their job is when you're introduced. I mean,
but it's always that question, what do you do? It isn't necessarily your job, what do you do,
right.
And how, I think in my IPR groups that I lead, we've had a lot of, if people aren't working, how do they answer that question? What do they say so that they don't feel, not normal and ostracized and stigmatized and things like that. So I just, it's a normal adult thing.
Yeah, that's such a good point. When I work with people and we'd ask questions like that so often, and this was a while ago, so I don't know if people would still say it, but people would say to me, I'm a schizophrenic. That's how they would identify with themselves. which is so, I mean, people are so much more than that, but that's all they believed they were because, they were coming into the program, but they weren't, I mean, they didn't have much of anything else. I mean, they were kind of working with their, their symptoms of their illness. And so they were focused on that primarily. Medication and symptoms. Yeah. Anybody else? Why do you go to work? It was a really good one.
When I think about work, it I don't know if it's because I'm a refugee to this country or what, but there's a sense of security that work gives us. And how many times do we hear people when employment is hard to get, and they look at families and they say, at least we have a job. When people say that, it really is a huge sign of security. Even if it's not huge money that we're making, or, it gives a sense of security to know that we have a job.
I agree. Yeah, that's so true. And I just, and again, I think the pandemic brought that home, when so many people lost their jobs, how that felt. And they, and so that sense of security was just ripped out from under them. And knowing you have that is just so important.
I'm not sure if we kind of already hit on this one, but also structure.
Yeah.
So I think of myself at the times when I've been on maternity leave, or like last year when we had some time off because of COVID and things like that. Like, you think you're going to get so much done because you don't have to be at work. And I find I'm not productive at all. That if I don't have that structure of, you have to get up, you go to work, and then you have this bit of time that after work. And so, we think of our clients too without that structure. And so that's one thing that I think for myself, why I have to work. But also, and I've had this discussion with my clients before too, it's actually a lot of work to be bored. It's hard to be bored. It's actually exhausting. Like, if you have nothing to look forward to and nowhere to be and nothing you have to do, it is exhausting for an individual that is that bored to try to figure out, what am I going to do with my time? So something to think about.
That's so true. Thanks, Susan.
Yeah.
It's a good point. Yeah, and that structure is, I agree with you. I thrive with structure. That really helps me to have that. So I have a group of girlfriends, and I'm the only one still working. They've all retired. And I'm like, I'm not ready to do that yet. I mean, I'm a worker bee for one, but I just like that structure. I like working. All right, anybody else? Otherwise, we're going to move forward.
I'd just like to share that I too am a worker bee, but I also like to learn and be challenged. And
oh, thank you.
Yes, and I need that. I need to constantly learn and be stretched and be challenged, and it's important to my day-to-day activities.
That's such a great point. I mean, that, work really provides us with this opportunity to have to challenge us to think about things and learn new information. I mean, I can tell you, and this isn't quite the same maybe as you're talking about, but, over the past year, technology has not been one of the things that I've thrived on. Let me put it that way. And here we are having this Zoom meeting. I've got the PowerPoint up, and I was able to do it all so far, knock on wood. But I mean, I've grown very comfortable with it. And so, that's something that I've had to change gears. I think it keeps your brain more active. I mean, I think it just kind of helps you to think through things a lot better. So yeah, thank you for that. And I think, just this sense of contributing to society, that you're making a contribution is really helpful to people. Okay, anybody else? Well, thank you everybody for sharing. I really appreciate that. So we know, we've talked about this, you've hit on all this, but when you just think about it, the positive impact of competitive employment for people with mental illnesses, it's similar to the general population. So people have increased self-esteem, improved financial security, reduced mental health symptoms, less social isolation, reduced substance use, and reduced healthcare cost. So, what we found is, and again, we kind of talked about this last week, but the general thought in the past with people with mental health conditions was that work was stressful, but as we were talking about, so is boredom, right? Not working or being unemployed is very stressful. And so, we want to help people to move on. Okay, so now we know, we talked through this, and so I believe that those of you that are participating in this believe now employment is good. Why is there such a large disparity between statewide employment rates and the numbers of people with mental health conditions working? So we know it's a good thing. So why is there this huge disparity? And let's look at this. So this is Iowa. So we're looking at your state. And if we look at the general population in the United States that are working, the employment rate is 75.6 for the general population. And if we look at your state's competitive, this is competitive employment rate, it's 81.7. So actually, you have a fairly higher employment rate than the general population of the United States in Iowa. So I don't know if you knew that or not. So employment must be pretty good, or opportunities. I don't know what's going on there, but that's pretty good compared to the general population. Then if we look at people with mental health conditions in the general population in the United States, people that have competitive work or employed is 21.7%. And in Iowa, it's 22.9. So again, you're doing better than the United States when it comes to people with mental health conditions. But the disparity is 58.8% between people in the general population and people with mental illnesses that are working. So this could be a target group for people receiving employment services. But if you wanted to take it to 100%, so let's say 100% of people, minus the 22% that are working, that'd be 77.1% of people with mental illness is not working. So not necessarily 100% of people want to work, right? Even in the general population. But if you thought about it that way, that's huge, regardless. Either way, it's just a huge percentage of people with mental health conditions that are unemployed or are not accessing employment services. We wouldn't stand for that if it were the general population. It's a human right to be able to work, and we just would not stand for it. I don't know, during the pandemic, I can't remember what the unemployment rate went to. I don't know if it hit 17 to 20%, but people were, it was outrageous at that time, So any thoughts about that? Or questions?
Sandy, do we think this is largely because for so many years we didn't expect people with mental illness to work, or we didn't think they could work?
I think that's what goes through my head, Lynn, is this thought about, well, maybe it's because, or people themselves believe they can't work. There's a lot of self-stigma, right? I'm not able to work. They've been told they can't work. So that could be a lot of it. I really believe, and we'll take a look at this. So, but what this shows is there's probably a lot of people that could benefit from working. And if we think about all the things we just talked about, that would benefit those people. So this is a survey that was done. And this was a survey that was done in these different, if you look over to the side, it says the survey population. So you can look at who were surveyed and the percentage of people that said they wanted to work. And these are all people that have serious mental illnesses. And so, you know, there are all these different, like if you were to survey people in sheltered workshops, 69% of people said, I want a competitive job. Okay, so all these different ones, veterans, which is interesting, is a little low. Look at the lowest though, which is the, or not the lowest, pretty close to the lowest. The lowest is psychiatric inpatient people that said they want it to work. But I think that's speaks to what Lynn was talking about. And people on SSD, SSI beneficiaries are the lowest. I think these are the people that have been, you know, that have serious mental illnesses and probably have for quite a while. The longer people are out of work and have a serious mental illness and it goes untreated, or, you know, the prognosis isn't as good for going to work. So I think these are the people. We know people, and I might have said this last week, we know people that are on Social Security. So when somebody gets on Social Security, only 3% of people ever leave. So if we help people to get on Social Security, the chances of them ever making a decision to go off Social Security, only 3% of people ever do. And so it's really a poverty trap. And I can't tell you how many studies I've done where we're trying to help people to go to work before they get on Social Security, and they're trying to get on Social Security. And once they get on, they just disappear. They're, you know, we can't find them for the study anymore. I mean, it's just like, so it's really, you know, a disincentive for people working. Some people really need it. I mean, they're going to be a group of people that need it, but I think a lot of people get on that don't. And I'll tell you, the group that worries me the most are these young adults. You know, people experience the first episode of psychosis, you know, helping somebody at 18 years old to get on Social Security and knowing that the chances of them ever going off is slim. So they spend their life earning, what is it, 700 and something a month? I mean, I don't know what rent cost in Iowa, or, you know, to have your own apartment or have a car or anything else. But boy, that's tough. It's a poverty trap.
So one of the things that I come across a lot when I'm helping people, because I do the IPR program, so that's a systematic method for making a choice, you know, a lot of times work-related goals. But so part of that decision-making process is if somebody's already on benefits, you know, do I work part-time? Do I work full-time? How many hours can I work? Those kinds of things. What I run across a lot is a lot of misinformation that people, or misconceptions people have about once they get on the benefits, how much I can earn, can I work, can I not work, will I lose my benefits? So it seems to me like I spend a good deal of time educating that you can work, and that you know, this is how your benefits will be affected. And if you do work and you decide you want to go back to work full time, you know, what do you need to earn so that you can still afford health insurance and those kinds of decisions. But a lot of times I come across people that have all kinds of strange notions about how work affects their benefits and where they've gotten this information. And it's always kind of like then a battle to re-educate.
Right. It's such a complicated system, you know, trying to figure out benefits. I mean, I don't even try. I did, you know, I was years ago a case manager too. And I go to Social Security with people, and I found every time we go, we get a different message or a different story from people. I mean, it's just like, it's so complicated. And then if you have one person that works and goes over and they have to do a payback, or they lose benefits, and boy, that's like wildfire. I mean, once that gets out, it's just like everybody believes it's going to happen to them. And you're right. I mean, you get the right information. I think we talked about this last week. You know, people that are like certified work incentive counselors are just amazing how knowledgeable they are. So, you know, getting individuals in to see those people, or giving people correct information. And there's a lot of work incentives and ways to help people.
Yeah, there's definitely a lot of work incentives, and right, as my role has just been to get them the correct information, and then they can make their informed choice.
Right. Yeah.
Unfortunately, they haven't been always informed real well. So
yeah, I agree.
So
Yeah, a lot of bad information out there. And and a little bit of professionals are providing some information, but they don't necessarily have the whole picture. And so they're not getting all the information they need.
Well, and it is such a complicated system that even those of us that have been trained in it know, and even probably the benefits counselors, every situation is a little bit different depending on how they're drawing their benefits. And because of that, they do get that one little piece of information. If we don't understand the system, how are we supposed to be able to communicate to them to understand the system? So it becomes a challenge for sure.
Exactly. It's really hard to refute a myth when somebody comes up with that, if you're not 100% sure of the real information yourself. And it is, like you said, Susan, such a complicated issue. That it's like anytime I have an opportunity to go to something and learn more about benefit at all, just so that, when somebody says, oh, I can't work more than X many hours a week, I know whether that's remotely true or not. So.
Yeah. And you don't want to advise wrong and find out that, hey, I accidentally told you could when you couldn't, or something like that.
Right.
So
the consequences are serious. Yes.
Yes, they are.
It's definitely a good thing to get them connected with somebody that's knowledgeable, but I think for me, that's what I run across the most is in people and beneficiaries that are wanting to work is that.
Yep. It's like one of the biggest barriers to people returning to work is fear of losing benefits. And they worked really hard to get on them, right? You don't get on them overnight. Right. I mean, it's quite a process. So, they've worked hard to get on them. And you can't blame people for wanting, health care. Right? So medications are expensive. So what we know is that only 2% of people who could benefit access effective employment services. So these are typically evidence-based employment services, only 2%. So the question is, if work is so good for people, then why isn't it along with housing as a central focus of the mental health team? It's like there's such a focus on housing, which of course, I'm going to agree. People need to have a roof over their head. So it's critical that people have housing, but shouldn't employment be equally as critical? We have worked with people that are homeless that will take getting a job before getting housing, and it's their choice to do that. So if given the choice, some people are going to say, I want a housing. Some people will say employment. I believe it's best to address both of them at the same time. It's just like any of the other things we've talked about. We're going to help you look for a job, and we'll be helping you look for housing. And you have people in the team that are helping to do both those things.
I really agree with you on that, Sandy, because at Iowa Total Care here, I've really made an effort to notify our behavioral health team on what's going on with the employment world so that they know in their work, their direct work with our individuals with mental health, that there is this strong focus on employment. So even though they may not be directly involved in getting that, person employed, they do have the knowledge then to say, hey, this is another positive support for you. This is who you contact if you want to know how your benefits would be impacted. Let's kind of get you back on the right track.
That's great. Thanks, Steve. Yeah, it's just so important that these are all being addressed. This idea of jumping through hoops, or we believe what you need to do first, as your practitioner, what I want you to do is focus on housing, and then we'll look for employment 6 months from now when you get in housing. And a lot of times people are like, well, that's not where I'm at. And so, but helping people to address both. I worked at one point, I was helping out with a study, and it was at a program called CODA here, which is a methadone clinic. And so we were trying to study IPS with the methadone clinic. And I was helping out with the employment specialist there. So I was kind of providing training and technical assistance. I'll never forget my first visit there. There was a huge line. I'd never been to a methadone clinic. I don't know if the rest of you have, but it was the first time I ever walked into one. And this line was like going out the door. And at first I thought, well, maybe they serve food, like, you know, a soup kitchen or something, because there were so many people in line. And then I realized it was the dosing station where people go in to get their dose of methadone. And the employment specialist office was next to the methadone line. And she would grab people in line all the time and say, where are you with employment? And so she was helping people to think about working. And I met this guy that was just amazing. And he was homeless, but he wanted a job. And I mean, he was in shelters, and he'd have to leave the shelter every day, and he'd have to find a place to lock up his clothing and stuff, a secure place. But all that he went through, that he got a job as a carpenter. And it was amazing to watch him grow. So it's just like that was his choice and what he wanted to do. So these we've already kind of talked about this, but these are other reasons why perhaps there's such a disparity, is that the lack of understanding about Social Security benefits, right? That might be preventing people from a return to work, or that disparity that we saw. That many providers were taught that work's too stressful. So we talked about that, you know, that, you know, I was definitely a part of that environment at one point, where it was like, you'll become symptomatic, you'll decompensate if you go to work, it's too stressful to go to work. You know, and lo and behold, what we found is actually providing people with lots of supports and returning to work, that structure actually helps to occupy people's minds, feeling productive, all the things we talked about, help people with their symptoms. You know, starting a new job is stressful for anybody. So you've got to be there for people. But you know, it's a good thing. And again, this what comes first mentality. We're not saying that people shouldn't work, but they need to be housed in treatment first. So the either or mentality might be preventing people. Other things that are kind of an issue in trying to get employment up and going, especially within the mental health system, is typically funding is not a one source funding. You know, for some things it's like therapists can count on a source of funding, you know, but with employment, you need to braid funding. You need multiple sources of funding to do that, because private entities typically won't fund employment services. Insurance companies aren't, a lot of insurance companies, not all of them, are funding employment services. So, you know, you're looking at Medicaid, you know, Medicaid waivers, vocational rehabilitation, state block grants. I know your NCOs have been helping out in Iowa, which is just fantastic, that they're jumping into the game and seeing this as a benefit. But this can be an issue to people accessing, you know, evidence-based employment services, is that the funding isn't there within the state to offer those services. The other thing is you have to have leadership buy-in. And we know this, there was many years ago, there was a whole, the evidence-based practice, National Evidence-Based Practice Project. That's when they were researching all the evidence-based practices for assertive community treatment and, you know, and supportive housing and IPS and the dual diagnosis, all those ones. And what they found is without leadership buy-in to implement, you know, these supported employment programs, evidence-based supported employment, they just wouldn't go. They would just die. I mean, you have to have leadership that are committed to keeping it going, that are committed to finding funding. So that's really important. So it might be another reason, you know, you have to have people raise their hand. And that's what you're talking about, like with Aspire, you know, these are, we call them now the early adopters states. So, I mean, sites, because those are people that are going to jump in early. They're like, I know this is a good thing, I want to do it. They're not kind of standing back waiting to see what happens. They're like, I believe in this. And so, you know, the idea that you're going to have leadership that says we are committed to making it happen. So that's the end for today. Next week, we're going to talk about strategies for promoting employment. So we know what the challenges are. So then how do we go about making that switch? What do we need to do as providers or NCOs or leadership, you know, in order to flip the switch, to start making things happen? So do we have any other questions for today? Any other thoughts about what you heard about today? Any other comments or things that you would add? Like I said, I'm always up to learning from all of you and your experiences. Was there anything in the chat box at all, Lynn? I don't know.
There's not any new items in the chat box since the last time we looked at it. So we do have a few minutes left, folks. If you want to, if you have any questions or comments, or just things in general about IPS that you want to ask Sandy about, now would be a great time for that. We are recording and archiving these webinars, and so after today, we should be able to send out the recording links and the PowerPoint links, and then next week we'll have our third webinar with Sandy, and that will conclude this little series about IPS.
So Sandy, just one, I guess, thought. It's really great to kind of level set everybody's understanding about the importance of this topic. But I'm also looking at, okay, so what are next steps? How do we engage people in doing this? How do we, develop a more structured approach to this? How do we get the outcomes that we're looking for in addition to providing the basic information?
Right, thanks, Dee. Well, so next week, hopefully we'll be talking some about that. And that's strategies for promoting employment. So thinking about how do we move forward? How do we take this now and try to push it out, right? What do we need to do in order to promote more employment? And that's really, as we talk about the importance of people working, and we all talked about, or not all of us, a lot of people brought up the importance of employment in their lives, and we want to see that for everybody, and we'd like to see people access that. So that disparity of all things, I'd love to see that shrink. Be interesting to look at it over the years and see if we can shrink it down. So next week, we'll be talking about it, but I'd love to hear more from your perspective of ideas you have in Iowa. A lot of things are state specific, so I can talk some about overall what can be done, but there might be things within your state that you know can be done that I'm not aware of. So it'd be helpful to hear from you. It's like I said, it's nice to see MCOs in your state that have jumped in and helped out with the pilot sites that are there. I mean, I don't see that a lot in other states, a little bit. I mean, I'm running into MCOs in certain states. Kansas was involved, so I'm running into this starting to happen, but that can be a game changer. So
yeah, I think we've been very fortunate in Iowa that our MCO partners have been engaged and involved on the employment front, like from the beginning, even though we've gone through, some churn. Everybody's aware we went through some churn in the MCOs themselves that were providing services in Iowa, and then certainly within staff, we've still had consistently interest about employment from our MCOs, and I think they're important partners. And I did want to mention, Aspire is a different effort than the one that brings us this webinar series, but it's okay. It all works together, right? Iowa has a great tradition of taking everything and throwing it at the problem and coordinating it all towards, one goal. And so some of the people that are with us here today on this webinar may not be aware that the Aspire effort required us to write a strategic plan, and that strategic plan sets a framework for how Iowa envisions rolling out IPS across the state over the next few years. And some of the first problems that we needed to try and solve we knew because of our pilot programs that were going on in northern Iowa and northwest Iowa that IPS could be very successful in Iowa. And places could do it with good fidelity. And then the problem we had starting out was for states to implement IPS, they need a state trainer. They need somebody like Sandy, who would be on the, boots on the ground and help people learn, help people form their teams and get some cohesion, within those teams, and then learn how to roll out the actual service and then have it reviewed for fidelity and so forth down the line. So the Aspire strategic plan kind of lays out how we envision making that happen. With the extra funding that is coming into states because of the pandemic and things, we've identified a place that we can hire our first state trainer, and we expect that to happen this fall. And then Sandy will be mentoring and training that person to become Iowa's state trainer and fidelity reviewer. And actually today, 4:30 today, applications are due for what we hope to be the first 3 early adopter sites or IPS teams that we will be selecting. And then the hope is that as time goes on, at least once a year, we'll have 3 more teams, right? And then we'll just keep building it up across the state slowly as that happens. So that's a little aside that we didn't plan for today, but since you asked.
And since I brought it up, huh?
Yeah.
I'm drifting into different projects. But I can tell you, as Lynn brought up, having a state trainer, I was one here, and the teams that we work with, it's such an interesting time, because you really are pairing yourself with these teams and helping them to improve. And so it's not like you're coming in to talk at people. You're working with people. I go out and do job development with a team. People are learning how to do job development and meeting employers face to face, and how do you get people jobs. I go out and do that and demonstrate and show people how to, and then have them do it and provide feedback. But we do things hand in hand. And so you really align yourself with teams and helping, because it's all about the better people's fidelity is, the better the outcomes. And we have a correlation with that with IPS. And so it's all about getting people jobs. How do we help people get jobs they really want to get that match what they do, and increase outcomes in the quality of services? So I'm really looking forward to being able to get started in Iowa.
Good.
All right.
Thank you, Sandy. Appreciate your time and your sharing knowledge and information with us. And thank you to everybody that joined us for this today.
Thanks, everybody. I appreciate your participation. See you next week.
All right.